Time for some What's Up Doc, where we get to spend some time with the healthcare experts at Mercy Health. We walk away from this having learned something every single week.
Right.
The doctors, unfortunately, walk away going, how is it I got picked for this?
How are these guys able to brush their teeth in the morning?
Can these guys spell doctor? Can they? Well, we can, I think, with a little prompting. Our guest this morning is Dr. William Cowden. We're going to learn about surgery from him. Dr. Cowden, good morning.
Good morning. How are you guys?
We're terrific. How's it going with you this morning?
We're doing great. Thank you for having me on today.
Hey, we're glad to have you on. When I saw this surgery, I thought of my daughter who has watched every episode of Grey's Anatomy and claims that if there were ever an emergency, she could get in there and perform surgery. And then when we all stare at her, she admits quickly that maybe that wouldn't be the case.
Doctor, have you watched any? We'll get right into it. Have you watched any medical surgery shows?
I haven't in some time. I'm an older guy, so I watched ER many, many moons ago, and that's about it.
Okay. How was ER? Was ER close to some of the real stuff without the drama?
Without the drama, maybe a little bit. I think back in the day that was the only metric we had to go off of for medical shows back then.
Yeah.
So there's a lot of new ones now.
Well, I always thought it'd be cool to be like Dr. McCoy on Star Trek. Instead of you grabbing a scalpel, you wave your little car cigarette lighter over somebody and they're better.
That would be awesome.
On ER, were they at least saying the right words most of the time?
I believe so. Yeah, every once in a while I remember catching them saying something that didn't quite make sense, but I think they tried to.
Okay.
You yell stat every once in a while.
Exactly.
It's the only one I know.
You should be fine. Dr. Cowden, tell us a little bit about you. Where are you from? What got you interested in medicine to begin with?
Sure. So I'm from Southern Illinois originally, and I really liked biology, anatomy in school, and I liked helping people, and so there was kind of a natural path to medicine. And so that's how I got into medicine and medical school, and ultimately after medical or during medical school, really enjoyed surgery, and so that's what prompted my pathway towards surgery.
We find a lot of doctors who say that it's kind of the family business. I think the last couple of times we've asked a doctor said, well, my dad was a physician. My dad was a surgeon.
Yeah, my mom was a nurse, and that's about my only family link to medicine.
And where'd you do all your matriculating?
So I am mostly a University of Illinois kind of guy. So I did undergraduate in Champaign, and then also did medical school, a combination of in Champaign and then actually here in Rockford. I did my training for surgery in Michigan, and then came back here in 2009.
Did you take the Kofi Coburn news in stride yesterday?
I'm sorry, say that again?
Did you take the Kofi Coburn news in stride yesterday?
Oh, yeah.
Okay.
Well, I think we all expected that.
Okay, good. All right.
Yeah.
It would have been better if he didn't know who that was. I would have found that amusing.
I know you would.
I would have enjoyed that, just to see you squirm on that one.
I had a feeling. Yeah, we were on the same wavelength there. We're good.
All right. Let's get more to the topic at hand. You've got a nice piece at the mercyhealthsystem.org website here as well, listing some things: general surgery, breast surgery, robotic surgery, Da Vinci, general surgery. I think people are fascinated by this Da Vinci surgery.
Oh, absolutely. I think a lot of people think that that's the new wave in surgery, and I get a lot of different kinds of questions about it even before we go into the specifics of surgery. I think many patients feel that a non-human is going to operate on them, and they are somewhat apprehensive about it. So a lot of my education for patients is actually kind of explaining the process, that it's not a robot that's doing it. I think a better term is probably robotic assisted, and so therefore I think that helps kind of calm their fears.
Yeah, that would make sense. If you think some clanking robot comes in and, people are, handing in a scalpel, yeah, that probably does take you back. But you work in conjunction with the robot. It's not as though you put the robot to work and pull up a chair.
No. So the robot is actually a couple of different parts, and so once the patient's on the table, as they are for all other surgeries, the robotic cart is then placed over top of them, and that's what has 4 arms. And then we actually, as a surgeon, sit at the console, which is a separate machine in the kind of the corner of the room, and it's like looking through a 3D viewfinder. Using our hands, we can then control all 4 of those arms.
What was your thought the first time you grabbed one?
I'm sorry, say that again.
What was going through your mind the first time that you were exposed to that Da Vinci robot system? The first time they went, okay, it's your turn to go work on this thing and see what it does.
I thought it was absolutely amazing, and I'm kind of a gamer kind of person, so it is very much like playing a video game at times.
Outstanding.
And how long has Mercy Health and or you been using the Da Vinci machine? Is that what you call it, a Da Vinci machine?
Yeah, Da Vinci robot.
Okay.
That Da Vinci is the name of the company that makes the robotic components of it, and so that's the name of the company, Da Vinci. It's robotic assisted surgery. How long we've had it has been quite some time. We've had the robotic surgery not long after I got here. In 2009, a bunch of different surgeons and fields of medicine use the robot for different kinds of procedures. We actually now have 2 robots at our facility, the more of the top line models at our facility. So we have 2 of them ready to go at all times.
And when do you decide to use it?
Well, we all see patients in the office to determine if they need a surgery or not, and then once we determine if someone needs an operation, then we can determine if they're a good candidate for some laparoscopic surgery or not. Some disease processes are, and some are not, and so that's kind of how we go through our decision-making process of what is feasible with a robot and what is not.
Yeah, with guys like Joe and I who love gadgets, it'd be one of those, hey, look, doctor, I have a splinter here. Can you get the Da Vinci thing out? And,
exactly. And that's not uncommon for many patients to ask about that, and so we have to kind of educate them about those things.
Do you see too as technology gets better and smaller and cheaper and all that you said you have 2 Da Vinci machines now? Is there a time where the hospital will have 50 Da Vinci machines?
Yeah, that's a great question. I think with the evolution of medicine and humans in general, I think that's potentially a thought is that move towards more and more minimally invasive things and having more machines and more robots to do that. So, yeah, that is certainly, I think, potentially on the horizon. I don't know if we're very close to that yet, though.
Doctor, you mentioned being an older guy, as a guy who's older than you.
When you said older guy, I was going, what? You said ER. I was like, I watched ER, man.
Come on, no. As a guy older than you, I think you have to be a certain age, too, to really appreciate this sort of evolution.
Absolutely. Not too long ago, most of the operations were done with a big open incision, and so then there's been the transition to more minimally invasive with the laparoscope and smaller incisions, and now moving towards the robot to help us assist those and make things even smaller and less painful and better outcomes for patients.
I'm assuming you get much quicker recovery time from this too.
Absolutely. The recovery times are a fraction of what they were with the more quote-unquote traditional approaches.
That's outstanding. Love to hear things like this. Tell us a little bit about your surgery team.
Excellent. So we actually here at Mercy have 4 board-certified surgeons, and in conjunction with that, to support us as surgeons, we have 4 mid-level providers. We have 3 nurse practitioners and a physician assistant as well. And then we have a lot of other individuals on our team for the trauma team that help do a lot of the background work that helps keep us in conjunction with state and national guidelines and keeps the machine running, so to speak.
You mentioned surgery teams, and I hope this analogy is going to make sense. When you're in there, are you more of a quarterback in there, or more of like a basketball point guard? Are you controlling all the action, or are you just more directing and facilitating? Within
the operation itself?
Yes.
Yeah, I think kind of a combination of all those things. We're certainly a team player, and certainly I think the old adage is that the surgeon is the captain of the ship, and so we certainly kind of direct how things go and kind of help coordinate the actual procedure itself so that it's safe and what's right for the patient.
What is acute care surgery?
So acute care surgery is kind of a newer moniker of basically emergency surgery. So patients come in with all kinds of emergencies. Trauma is a great example, but there's also non-trauma emergencies like a ruptured appendix or a ruptured something else that needs absolutely emergent treatment. And so acute care surgery is kind of a combination of those things that all basically require something emergent. So emergent general surgery, emergent trauma surgery, which most traumas are emergent, obviously. But some general surgery things are not necessarily emergent. We see people that in our office that have had hernias for weeks, months, years. Those are not emergent, but do need to be addressed in a timely manner.
I don't know if I've ever heard the root word of emergency used like that before.
I know. See? That's why I tell you, we walk out of these interviews always having learned something.
I've learned a lot.
He'll walk away shaking his head. We'll walk away having learned something.
Ask me basketball questions. I don't know what the hell he's talking about.
And your trauma department is something to be proud of as well.
Absolutely. So we are a state-designated Level 1 trauma center, and so that means that we're here 24 hours a day, 7 days a week, 365 days a year, and we have many individuals that respond to trauma. So it's more than just me and a couple people. We have our surgeons, our anesthesiologists, our OR staff, our ER physicians, ER staff, radiologists, respiratory therapists. All of those individuals respond to our traumas to help provide evaluation and care for our trauma patients. We see at least 1,000 patients a year, both penetrating and blunt trauma, and there's multiple system traumas and multiple injuries. We address all those things, and in addition to that, we welcome transfers from other facilities as well.
Doc, one more question I got to ask you that's been on the back of my mind since we started talking about the Da Vinci, and you mentioned you're a gamer. Riley and I, we're both gamers too. We like it. The first time you sat down to it, were you working on a live patient, or was there some sort of practice round for you to use the Da Vinci?
Yeah, no, there's a lot of practice and a lot of criteria that goes into actually performing and mastering before you're even allowed to sit near a patient. And so there's two different approaches for basically garnering privileges to use the robot as a surgeon. One is if you had experience during your training, and since the robotic surgery is kind of newer, that wasn't necessarily around when I was doing my training. So the other approach of having privileges is to garner that experience through a training module that's put through the Da Vinci company itself, where you witness and basically just watch a surgeon do many of those surgeries, and then there's an online module. All of our robots, and most robots systems itself, actually have a practice setting where you can do games virtually, for the lack of a better word, games, both virtual games and then using models like pegs and round objects and suturing and all those things. So there's a lot of practice that goes in, and there's other kind of labs, and then you actually have to have a proctor come and watch you do 5 procedures and assist you with 5 procedures before you're allowed to actually perform the procedure on your own.
And Dr. Cowden, before we let you go, the big question, of course, can you do one of those little origami doves that they do in the commercial?
Mine is not as cute as a dove.
Okay.
Or a ball.
So, yes, I'm going to go with yes, you can do that. Dr. William Cowden, thanks for taking time out of what obviously is a busy day every single day. This was really enlightening. You got a great sense of humor. We really appreciate you being on with us this morning.
Thank you guys for having me on today.
We love What's Up, Doc, 850, News Talk 1440, WROK.